The implementation plan is an aggregation, ladies and gentlemen, of the micro plans that have been developed at the regional and parish levels. It takes into account the appointment system, vaccination allocation, and the operational flow of the fixed and mobile vaccination sites.
We are projecting to May that we will have approximately 975,000 vaccines in our arsenal for inoculation. And based on that projection, we intend to roll out the different phases of the implementation of the vaccine. We have 3 phases. Now, phase 1 would have our government officials, our healthcare workers, the elderly, JDF, etc. Phase 2 has the other public sector workers, hotel workers, transportation sector, manufacturing sector, banking sector, the agricultural sector. The principle behind phase 1 is that we are looking at the vulnerable groups, the persons who are in high contact areas or are coming into high risk for contamination. We're looking at the persons who are highly vulnerable for negative outcome from infection. And our phase 2 implementation are those persons within the economy or the society that are essential to economic activity. And so we look at the different economic groups and we will be prioritizing those persons. And then our third phase is a general population phase that looks at those persons within the general population who require vaccination. So our target is 65% of the population by March 31, 2022. In March, we begin our vaccination based on the donation from India and based on COVAX providing the additional some 14,000, which gives us about 64,000 committed vaccines for March. We gave our first dose in March and April and the second dose in May and June. So by the end of June, we will have completed phase 1 implementation, all things being equal. For phase 2, we begin in May. And of course, we do our second dose application at least 4 to 8 weeks after our phase 3 implementation would be the general public. And we would run that program as we move through the different months. Now let's look at the appointment process. So once you are identified in a group, phase 1, phase 2, phase 3, a public call will be made. Now currently a lot of the public health institutions, the public health departments across the island have been reaching out to the different groups in phase 1, and they have been identifying those persons who definitively say that they want to take the vaccine, and they have been collecting their data. So as we move to the different phases though, we will be making more a public call for persons in phase 1 like the teachers, or we're making a public call for persons in phase 2, persons in the banking sector, etc. Now, if you wish to get an appointment, you must start the appointment process 5 days before you want your actual appointment. And when you ask for your appointment, you have to provide certain information: your age, date of birth, your area of work, comorbidity, your allergies, your address, the venue that you wish to be vaccinated at, your telephone number and email. Basic information that will guide us. Now you can make this application or this application for appointment in 4 different ways. A call center has been contracted by the Ministry of Health, and that call center will operate our 888 One Love number, and persons will be able to call into the 888 One Love number and make an appointment. The parish health department will also be enabled to take calls from the public or the persons in the different phases and allow them to make an appointment. You will be able as well to go on the Ministry of Health and Wellness's website or the website of any of the regional health authorities and make an appointment. As well as you will be able to walk into any of our public health, parish health departments and make appointments.